Eastern Cape Premier Oscar Mabuyane has described the late renowned paediatric cardiologist, Prof Lungile Pepeta, as a great loss for the health fraternity in the province. Pepeta also served in Mabuyane's advisory committee in the fight against COVID-19. He died of a COVID-19 related illness yesterday at Port Elizabeth Hospital. Our reporter Abongile Jantjies spoke with the Premier in East London.
A very good morning to you in studio and a warm welcome to our viewers at home. Well, indeed, the province is in shock and is in mourning, especially the health fraternity, because of the death of the renowned professor and cardiologist Lungile Pepeta. Well, he had an illustrious career throughout, and he played a pivotal role here in the province, specializing in cardiology. And he was appointed as part of the Premier's Oscar Mabuyane's advisory panel on COVID-19 related matters. And he was based in the Nelson Mandela Bay, which is the epicenter of COVID-19 here in the province. And he did indeed, and it has been described as a great loss here in the province, particularly at a time where the deaths are increasing rapidly, even though there are recoveries. But he was this person who really played a pivotal role, and he's yet to be missed dearly for his work. But to tell us more, I'm now joined by the Premier of the province, Mr. Oscar Mabuyane. Premier, a very good morning to you. Clearly a sad loss and unexpected.
Very great sad loss, I must say, losing a man of his caliber, with all the investment that has gone through him. It's something that will forever be very cutting deep into the wound that we are now experiencing. Professor Pepeta has been one of those really patriots that epitomize the excellency, so to speak. He is ever willing to be available. He's actually unparalleled skills were something to marvel wherever he comes in. As you have just indicated, that he has been in the health sector for some time. He has served our country at a national level through the appointment by the minister. He has been part of the district command council representing the university, as he was a dean of the health the faculty there. He has been part of our 15 panel member of experts that were advising the province on COVID-19. They came in at a very critical time when we were actually grappling with the challenges of COVID-19 in the province, and also the understanding of the COVID-19 itself. So we then assembled that panel, which is made up of different people from different sectors in the socio health services, so to speak. So Dr. Pepeta always come in there handy. Not a single meeting where he will come in and not share ideas. He will always be there to share ideas and make proposals, and that has helped us a great deal as a province. I've also worked with him before because he has been instrumental as well, leading the university team on the establishment of the medical school in the National Mandela University. So we lost a very handy person in him, a really community builder, a developmental specialist, so to speak. He is always having that kind of foresight. He's always looking beyond. Actually, he was always broadening his horizons, and how he engaged us as the leadership of the province on why there is a need of an additional medical school in our province. So those kind of memories, they really come back when you think of him. Very humble, very dedicated, a very focused man. A lot was still to come out of him. So we have really lost a giant in the sector, and we have lost an expert in the field. So you see, and it's something that is not going to be easy to actually forget, knowing his indelible mark that he has made in the life that he has lived, and you can see the dedication he has, and as a specialist, as a pediatrician, and so he has done a lot. He has done a lot for our country. He has done a lot for our province, probably the world itself. We are losing him at a very critical time, when the entire world is really grappling with this COVID-19. But he was a soldier. He died with his boots on. He was always combat ready. That was one thing that actually distinguished him, probably. So he has always been available. I had a couple of chats with him when he was in hospital, and unfortunately assured me that, no, Premier, I'm getting out of here. I can't succumb. I'm fighting this. At some point, he said himself to me that no, he's much better. He's actually recovering. So I had such hopes that he's going to stand up. And I said, actually, in my last text to him, that it is not belonging there in that bed. He's belonging outside. A lot of people who are waiting for him outside to take them through this. So he was there. He was not one of those armchair critics. He had views, very strong views, but he was there to provide solutions, to find solutions, to work with us, embrace us, correct us as we're moving forward as a province. So we would really want everyone to emulate him, especially in that sector, even other people who think that they are experts out elsewhere. We are open as a province. We have said this province doesn't belong to us. We are just leadership. Leadership comes and go. We want everyone to come and play a role. That's why we thought we can't be where we were as a province when we have got such great minds, such great brains that we actually have developed in this province. So we are really quite happy that he has played his part until his death. Condolences to his family and his wife and kids and the family at large. I know they've really lost a father, a brother and a sister and a husband. We have lost an asset as government, as people of the Eastern Cape.
Let's talk about his ideas, Premier, particularly in the Nelson Mandela Bay, where it's the epicenter of the province, in the province. And social media has been praising him as this renowned person who really played a pivotal role and in fighting, especially you would give advices at hospitals like Dorangenza, where it's troubled, and particularly the whole of the metro people, especially from there, they are saying that the province has really lost a great person. But his ideas, what are these ideas that he really spoke about, particularly at this time of COVID-19?
As I've indicated, that is one of those people who volunteered. Was the university offered a lot of support, including its mobile clinics, the healthcare mobile clinics, and he's one of those who volunteered to be part of the technical support to the District Command Council. Voluntarily, I went there. I met the university. When the district itself was actually found wanting in establishing its district command council, we actually literally kind of nudged everyone into that, and then from there we never looked back, and we continue to move forward with him. He has got great ideas around these issues of tracing, issues of treatment. We don't have a vaccine, we don't have a cure, but how you treat those symptoms that are coming with this. So as a specialist himself, he understood the virus very well, so he has always been there to offer that technical expert opinion when we needed it most. So all his issues and ideas of field hospitals, etc., he would always be coming handy in terms of making some proposals, etc. That's why the university was the first to actually assist the government to say we do have mobile clinics here that can be used as part of testing that we're doing. At that point, we're doing massive testing. We're doing a solid job on tracing, etc. So he would always, and the issues of hospital management and the clinical services that are offered in our hospitals and the beds, he would always be concerned about how we were talking about availability and not availability of beds, and then the issues of oxygen. So he was actually an all-rounder, so to speak. He had all these kind of ideas. He had a passion. he was very passionate about helping people. He actually leaves that legacy of a very selfless patriot that I believe that we should be able to look up to him on that, and also the level of sacrifice, even to sacrifice himself to be where he is. And surely if he would have just kept himself in the university or in his practice elsewhere, and he would not probably be where he is. But because of that inner ability to help those who are in need, that commitment, that was amazing to see from him. So we have really lost, as I've indicated, a giant, and is a very special person in our hearts, and he will remain flamboyant in our minds because he has been doing a very great job for our people, for downtrodden, vulnerable our people.
Lastly, how do we plan to remember him as a province?
Surely his legacy will live on. We will continue talking. I know the university is working on its plans. I think there are great ideas we will share with the university, but his name must actually be somewhere, really be a symbol of hope to other young people, because a young man from an area of Bizana to come in, develop himself to be where he is actually an aspiration to a lot of other young people in this province and this country, especially from the rural part of our country. So surely we will be able to look at that. As a premier, I've already instructed the administration to write to President and ask the President to consider honoring this giant in the befitting way and give him a send-off that he deserves.
Well, Premier, I thank you so much for your time. Well, there you have it from the Premier of the province, Oscar Mabuyane, telling us about the late Professor Pepeta. Well, indeed, surely he will be missed for his great work. We hope to bring you more on this story. But from us here in East London, myself, Abongile Jantjies, and my colleague, Vuyo Funani, it's back to you in studio.